The Centers for Disease Control today released a shocking report on drug-resistant diseases in this country. The CDC warned that the spread of these superbugs and the abuse of antibiotic drugs by the medical community could one day endanger America and develop into a national catastrophe for Americans. Fox News senior national correspondent John Roberts in Atlanta with our live report. John?
Good evening, Lou. You know, it's already endangering society because this problem, even though we've talked about it many times before, is getting much worse. The Centers for Disease Control tonight is issuing a very, very urgent warning about the proliferation of dangerous bacteria that are either resistant to or downright immune to even our most powerful antibiotics. And they have, for the very first time, calculated the number of illnesses and deaths that result from it. It's a stunning statistic. Let's put it up on the screen for you. Look at this. Every year in the United States, 2 million people are made sick by these antibiotic-resistant bacteria. 23,000 of them die. The Centers for Disease Control Director, Dr. Tom Frieden, says we are facing a health crisis in this country unless something is done.
What we've seen is as we've developed new antibiotics, every time a new antibiotic comes onto the market, there are some bacteria that gradually or quickly develop a resistance to that antibiotic. And now we're seeing a situation where some bacteria have resistance to all or virtually all antibiotics.
For the first time as well, the Centers for Disease Control has brought together in one place the 18 most dangerous microbes and ranked them according to the threat that the population faces from them. The most urgent threat comes from three very nasty classes of bugs. First of all, Clostridium difficile, that's an intestinal bug. Then there's the carbapenem-resistant bacteria that include the familiar E. coli and Klebsiella, which causes pneumonia. And then there's a particularly dangerous drug-resistant form of gonorrhea out there as well. The Centers for Disease Control has been issuing warnings for more than a decade about this looming emergency, yet according to our Dr. Mark Siegel, more frontline physicians need to get the message.
I think as doctors become more and more aware that they have less and less arrows in their quiver because drug companies are not making more antibiotics. So we have less and less treatments to offer. So our jobs as doctors become less and less effective the more resistance there is. Maybe we have to learn that way, the hard way, but it's time for us to learn.
So the Centers for Disease Control is turning up the volume, trying to get the word out and encourage drug companies to make more new antibiotics before, as the CDC director puts it, the medicine cabinet is empty. Lou?
John, startling numbers indeed. But as you know, as we discuss incentives here, trying to encourage drug companies to produce more antibiotics, more effective responses. I mean, that's all about money. That's all about markets.
It's always all about money. You know, drug companies don't make a whole lot of money on antibiotics. They make them on the rare drugs that they can have patents on for 17 years. And when they come out with a new antibiotic, these bugs are so quick to catch up that the antibiotic's not effective for a long period of time. But here's the overall health cost. You know, you talk about the cost on one side with the drug industry. Right. Here's the cost in the healthcare side. Just Clostridium difficile every year results in $1 billion in excess healthcare costs. In direct healthcare costs from all 18 of these bugs, it's about $20 billion. And when you include in the associated costs, it's running north of $35, almost $40 billion a year, Lou. So there are economic incentives here to do something about it.
And C. diff, as you reported, it is one of the deadliest diseases out there.
Yeah, you don't want to come down with that, right? That's for sure.
Or any of the rest, for that matter. John, thanks so much, as always. Great job.
Thanks,
John
Lou.
Roberts.
Good to see you.